Welcome back to my channel, and in this video I'm discussing something extremely important and a very commonly asked thing to me by my patients that, Doc, I am interested in LASIK surgery. Am I a good candidate or not? Should I go for it or not? And all those things. So I thought to make a video and help everybody here. LASIK surgery, yes, that's the topic. Whether you should go for it or you should not go for it, what should you expect, and all those things. So please stay tuned till the end of this video, because the conclusion and the last part is the most interesting part. Selection criteria. That's one of the most commonly asked part in any eye exam related to LASIK surgery, that should I go for it or not. So if you are 18 years and above, yes, you can go for it, but there are more things than your age only. Okay, other thing is refractive error. By that I mean whether you are a hyperope or you are a myope, there is a limit. For myopes or nearsighted people, the limit is 10 diopters. If you are below or in that 10 diopter cutoff, you can get the surgery done. Some surgeons are very restricted. They have put that as a -8 diopter also. So it depends on your surgeon. And for hyperopes or farsighted patients, the cutoff is 4 diopters. If you are above 4 diopters in your prescription, then you are not a good candidate for the LASIK surgery. And then comes the astigmats. People who have astigmatism, not all of them are turned off from LASIK surgery. You cannot get LASIK surgery only if your astigmatism is above and beyond 4 diopters. Even there are some machines and some doctors who can do it up to 5 diopters of astigmatism. So again, it's very patient specific and the practice specific. Another important thing is your prescription. The prescription of your glasses or your contacts makes a good selection criteria. So you need to make sure that your doctor is looking into those things. And let's say your prescription changed more than 0.5 diopters or more than 10 degrees of axis shift during that 1 year of your prescription, then you are not a good candidate for LASIK surgery. But if it did not, then you're a good candidate. So it depends. And again, another part of your selection criteria is your profession and your expectations. If you are in a specific profession where we cannot afford the flap dislocation risk or complications, then you're not a good candidate. So patients have to be aware of that what are the realistic and the unrealistic expectations from the LASIK surgery based on your specific pre-operative evaluation, whether they will still be dependent on the glasses or contacts after the surgery or not, or whether the dependency is going to reduce after the surgery or not, or whether you are going to be totally off the glasses and the contacts after the surgery. So it's 3 different groups. Some people are totally off, some people are partially off, some people are not off at all. So it depends on all those expectations. So set up a realistic goal for the surgery and then go from there. Okay? And it depends on every patient and every surgeon and every prognostic outcomes from the procedure itself, from the surgery itself. So patient expectations are exceptionally important, because you don't know what are you expecting. And let's say a patient is -10 diopters and he wants a LASIK surgery. Some machines cannot fix all of that 10 diopter. Okay, so you may end up requiring some glasses, and some patients don't end up. So it depends so much on patient to patient in the pre-operative evaluation that we can tell them. Okay, another thing is presbyopes. When we get older, we all require readers. That's the simplest definition of a presbyope. Okay, so presbyopes who are going for a LASIK surgery, they need to be aware of their post-operative distance vision, post-operative intermediate vision, and post-operative near vision. You need to be aware of all of those things, that what's going to happen to all those three things after the surgery. Ask your surgeon about these things, okay? It's very important to have a thorough discussion on this topic. And the patients who already have dry eyes before the LASIK surgery, imagine the amount of dryness that you may have after the surgery. So please be aware of post-LASIK dry eye syndrome, post-LASIK dry eyes, and ask your surgeon what's going to happen to that part after the LASIK surgery. And after the LASIK surgery, what's going to happen to your other symptoms like halos, glare, night vision problems? Please discuss them out with your surgeon before you sit into the surgery. And what about the recovery time? You need to set up certain expectations from the surgery, that what's going to be my recovery time? Is there any risk of infection? Is there any risk of inflammation? When I'm going to be back to the work? And some of the important parts that I discussed before this thing as well. So you need to set up all those expectations and what's going to happen. So you need to be aware of that. And also importantly, ask your surgeon about enhancement, that hey doc, am I going to require any enhancement procedure after this as well or no? Please ask your surgeon about this thing, because sometimes you forget to talk about that kind of stuff before the surgery in your pre-operative evaluation and your assessment, and then afterwards you end up finding that, oh no, I need another surgery or not on top of my last surgery, and then you are shocked and you're leaving us the negative Google reviews that this doctor referred me for surgery, he's bad, and this doctor did the LASIK surgery, he's also bad, and blah blah blah. But you need to ask them. It's your time, it's your right. Ask them, okay? And then a very important part of this discussion is, what are some of the absolute no's or absolute contraindications where you should not go for the LASIK surgery? From the systemic health standpoint, there are some absolute contraindications. For example, if you have a collagen vascular disease, for example, lupus, scleroderma, rheumatoid arthritis, polyarthritis nodosa, ankylosing spondylitis, ankylosing spondylitis, or you have psoriatic arthritis. Those are the things that, negate the surgery to a huge extent. Again, some surgeons are very smart, very good. They might look at your results from those diseases and see whether you can go for it or not. So discuss them out. Advanced and uncontrolled Sjogren's syndrome, that's a big no for the surgery. Or thyroid or eye disease, that's another no for the surgery, okay? That's important to know, because there is a lot of patients who want LASIK surgery, but they have Sjogren's syndrome. And it's an advanced form, and it's an uncontrolled form, and they still want LASIK surgery. And when they get the LASIK surgery, they hate the LASIK surgery. So that's why I'm discussing those things here, that, man, you should know that this is your general body systemic health that is negating your surgery. You have thyroid eye disease, and that's negating your surgery. You need to be aware of that. Uncontrolled diabetes, if your diabetes is uncontrolled, you cannot have that surgery. Why? Because that can lead to refractive fluctuations, fluctuating vision and prescription. Poor healing from the LASIK itself can happen from uncontrolled diabetes. Reduced corneal sensitivity, especially if the A1C is above 7.9, that's a big problem. That's a big red flag. And that's why these are the absolute no's for the surgery. So please be aware of that. Another big no and absolute no is pregnancy. You are pregnant. You want to finish your pregnancy and finish your nursing, and then you can go for the LASIK surgery if you are in a good criteria part. Why? Because there can be transient refractive changes during the surgery or during the pregnancy. If we do the surgery during the pregnancy, we cannot do it. Or corneal curvature fluctuations also happen during pregnancy, and then they reverse after pregnancy, and after nursing another change can happen. And then what? you can end up with a lot of complications if you really want it during pregnancy. So please don't force your surgeon to do it right now. That's not a good way to go about it, okay? Dry eyes, absolute dry eyes, as I mentioned earlier, sometimes could be a big no for the surgery. Fetal or infant risk of topical medications is also another important part of not why we are not going for this kind of LASIK surgery during pregnancy or nursing. Sometimes, or when it could be a no to a LASIK, or maybe a relative no, or maybe a relative contraindication, is controlled diabetes. Controlled diabetes means your A1C is less than 7.9, so it depends on the surgeon. Some surgeons might do it. Keloid formers need a caution in their LASIK surgery. HIV patients, they need a caution in their LASIK surgery. So it depends on patient to patient and surgeon to surgeon. Some medications, for example, Accutane, isotretinoin, cortisone, amiodarone, Imitrex can slow down your healing. It's a famous medicine in many countries. It's given for migraine. It can slow down the corneal healing after the LASIK surgery. So yeah, sometimes it's a relative contraindication. So discuss with your doctor about it, because there could be some special cases also. For example, patients with pacemakers or defibrillators may need some extra caution and clearance, and anesthesia intolerance is possible, or patients with inabilities to fully recline for the surgery and fixate may have some issues. So it depends on patient to patient. That's why these are relative contraindications. Not everybody is given a no if their things are within the criteria. So check it out with your surgeon. Absolute ocular contraindication. So here's a list that, okay, if you have these things in your eyes, you cannot go for the LASIK surgery. Number one, and a very important one, is keratoconus. If you have keratoconus or corneal ectasias or thin corneas, you cannot have corneal surgery or LASIK surgery. Please be aware of that. Or if your criteria is not met, as I discussed previously, then you cannot have the surgery. Or if your prescription is unstable, you cannot have LASIK surgery. If you have severe ocular surface disease or lid malformations, the lids are not good and they are leading to the ocular surface disease, then you cannot have LASIK surgery. If you have bad corneal dystrophies, your cornea specialist is going to say no to your corneal surgery or LASIK surgery. Corneal neovascularization. Sometimes we find some sort of neovascularization in your cornea into the ablation zone of the surgery. We say no to the patient. No, you cannot have a LASIK surgery. Uncontrolled glaucoma. If you have glaucoma and it is uncontrolled, then it's a no to the surgery. Monocular, one eye is a lazy eye. That's another no to the surgery. Retinal issues in the back of your eyes, in your retina, can also say no to the surgery. So important thing is be aware of those things. Relative contraindications mean, yes, there are some ifs and buts here. Doctors can find a way out to get rid of those and then do the surgery. Those are corneal dystrophies, herpes simplex virus, treatment zone, or corneal scars. If you have corneal scarring in the treatment zone, many surgeons are going to say no to that. Previous corneal surgery is also sometimes a no, but again, it's a maybe thing. So it depends on the surgeon, it depends on the cornea, it depends on the previous corneal surgery. Ocular pathologies, as I mentioned, cataracts, glaucoma, retinal disease, and optic nerve diseases. Large pupil, it's important to check the pupil size. Sometimes large pupil is a no to the surgery, especially if it's more than 6.5 millimeters in the scotopic conditions, in the dark conditions. Even if your pupil is that big, that's a bad sign, and that's a sign that you will not like your surgery. Preoperative protocols. Preoperative protocols are important. First and foremost thing is discontinue wearing your contact lenses. If you are wearing the spherical contact, you have to discontinue for 1 week. If you have toric contact lenses, you discontinue for 2 weeks. If you have gas permeable GPs or gas permeable contact lenses, you DC or discontinue them for 3 weeks, okay? Another important part of the preoperative protocol is cyclorefraction. Sorry about that, tongue twist. Cycloplegic refraction is important for every single patient who is going for a LASIK surgery, and there must be a difference between cyclo and non-cyclo refraction that you are evaluating, and we want that difference between the two refractions to be less than 0.5 diopters or 10 degree shift. We want less than that. Corneal evaluation with corneal topography and pachymetry are extremely essential. Pupil size in dim and in bright is extremely important before the surgery. Some surgeons like to do aberrometry. Not everybody has aberrometry. We need to know the dominant eye. So binocular vision testing, BV evaluation is extremely important. Dilated eye exam to make sure that the retina is good in the back is extremely important. So that's the preoperative thing that you have to do, and make sure you're ruling out any contraindications that are there that may be there that may cause trouble post-operatively. I know I went by pretty fast, but I know people have short attention spans. Not everybody's able to watch the whole video, so that's why I was going fast. Ask me if you have any questions. I have another part 2 on this video that's coming soon. Please stay tuned and ask me in the comment section if you have any questions. And please like, subscribe, and share to my channel. Thank you so much. Have a great day.